anumang paniniwala sa Diyos man, kay Allah o kay Bathala, iisa lang ang ating panalangin. Ang ating malagpasan ang dinaranas na pagsubok ng ating buhay. Kami po ang pasada at ito po ang aming awit, ang Bathala. Bathala, Bathala, tao ay tulungan mo, linisin ang lumalason sa kanilang isipan. Bathala, Bathala, tao ay tulungan mo, bawiin ang mga yaman sa kamay ng ina. Lupa, dagat, kabundukan. Biyayang galing sa kalikasan, alay sa ating ibathala. Sa tubig may laya, ang lupa ay tulay, langit ang ating buhay, diwa ay kaagapan. Sa tubig may laya, ang lupa ay tulay, langit ang ating buhay, diwa ay kaagapan. Langit, lupa, dagat, kabundukan. Biyayang galing sa kalikasan, alay sa ating ibathala. Langit, lupa, dagat, kabundukan. Biyayang galing sa kalikasan, alay sa ating ibathala. Bathala, Bathala, Bathala. Oh, Bathala, Bathala, Bathala.
Thank you very much, Pasada, for a beautiful song. As the words were saying, our spirits are side by side. We are connected. I think that is the message that they're bringing forth. We are given so much of nature for us to thrive, not only to survive. And because of that, we should take care of nature as much as we take care of ourselves. So thank you for the beautiful song. Now, let's learn more about the global roadmap for healthcare decarbonization. Introducing Josh Carliner, Healthcare Without Harm's Global's International Director of Program and Strategy. Let's give a hand of applause. Take it away, Josh.
Thank you very much, Dr. Glenn. And good morning, magandang umaga, salamat pagi. Good morning to everybody in Southeast Asia, and greetings from San Francisco, California. The Ramon and his team asked me to present the global roadmap for decarbonization, so then we can have a conversation about how it is relevant to Southeast Asia. And so that's what I'm going to do. I'm going to share my screen with you. Hang on one second here. And we should have it up and running in a second. Okay, can everybody see that? I hope so. All right, so I guess I want to sort of pick up where some of the where Dr. Glenn and Ramon left off, and talk a little bit about the context or the landscape in which the global roadmap is coming. We all know that the climate crisis is accelerating. The figure that Ramon shared is actually, I think, a quite huge underestimate by WHO of 250,000 deaths from climate change. We know that in many places in the world, we're seeing 4 times the rate of death, for instance, from heat stroke with rising temperatures. And we also know that the IPCC, the Intergovernmental Panel on Climate Change, in its 2018 report, said basically if we don't reverse course in the next 10 years and significantly reduce global greenhouse gas emissions, the very underpinnings of our civilization are threatened. And so, the climate crisis is accelerating, and we have very little time to actually change course, respond, and transform our societies to protect public health from climate change. The COVID-19 crisis, the pandemic, has also shown us in a painfully exquisite way what a global crisis on a planetary scale looks like. And what we know is that climate change could make COVID pale in comparison. The positive outcome of COVID-19, if there can be one, is that the response and the recovery to it and the investment in that recovery provides us an opportunity to begin to transform our societies and economies on the basic principles of healthcare, which are prevention and preparedness and health equity. These are paramount principles if we're going to respond to the COVID crisis. They are and prevent the next pandemic. They are also key principles for preventing climate change, the worst of climate change, and building resilience to it. So all of this implies that we need fundamental systems change in our economy, in how we use energy, in how we produce our food, and in how we provide healthcare. So in 2019, Health Care Without Harm released Green Paper 1, Healthcare's Climate Footprint. There had been a lot of work done over the last decade or more on the need for health adaptation to climate change. We've seen that a significant work done by the World Health Organization, by many other organizations, and funding for health adaptation and climate resilience for the health sector. But what had not been looked at so much was healthcare's contribution to the crisis. And what we found when we did this study was that 4.4% of net global emissions, of all global greenhouse gas emissions, came from the health sector. In other words, if healthcare were a country, it would be the 5th largest climate polluter on the planet. And so that finding also came with a set of recommendations, and sort of the core recommendation in the paper was that the healthcare sector needed to align with the ambition of the Paris Agreement to protect public health from climate change. And that means basically moving toward zero emissions by 2050 and helping contribute to keeping global climate change at 1.5 degrees Celsius or below. And so based on those recommendations, we set out to build the global roadmap for healthcare decarbonization. And so today, I am really pleased to share with you Green Paper 2, the global roadmap for healthcare decarbonization. It is the first ever attempt to chart a course to zero emissions for the health sector. It is intended to be a navigational tool for achieving decarbonization with climate resilience and health equity. It is a collaboration with the global consulting firm Arup, who did all of the technical modeling and projections in the roadmap, merging global health and climate data. Its development was guided by a prestigious advisory group of health and climate leaders from around the world. So the roadmap identifies how healthcare decarbonization, resilience, and pandemic preparedness can be mutually reinforcing and synergistic. It projects trends into the future and identifies key pathways forward. Its main message is threefold. First, the health sector needs to exert leadership to take on the climate crisis, which presents a series of health threats that together could make the current pandemic, as I said before, pale in comparison. Second, healthcare can and must chart a course to zero emissions in an unequal world, where some hospitals and health systems are huge climate polluters, and others don't even have access to electricity, and many people don't have access to care at all. So healthcare decarbonization must contribute to achieving both greater health equity and climate justice. And third, to get there requires a major transformation of the sector. Transformation in how health is financed and delivered, transformation of how healthcare goods and services are manufactured, packaged, transported, and disposed of, transformation of the broader society's production and consumption of energy, food, and more. So the roadmap also has a series of 68 country fact sheets with data for all of those nations that are drawn from two different databases that underpin the roadmap. So and in Southeast Asia, we have fact sheets for Indonesia, Malaysia, South Korea, Taiwan, Thailand, Philippines, Singapore, and Vietnam. And so here you see a couple of samples of parts of each of those fact sheets. And you can find more information about the fact sheets, what they're based on, and download the fact sheets at the healthcareclimateaction.org/roadmap site, which is where the entire roadmap is housed. So it is a dynamic online report. You get the roadmap, you get a technical report that shows how we did the research, those country fact sheets, a set of interventions that are recommended to actually achieve some of the goals of the roadmap and the actions that we're recommending. So specific interventions that hospitals and health systems can take, as well as downloadable graphics. All of that online at that URL. So check it out. You can read the executive summary, you can read the entire report and all of the annexes and the fact sheets. And when you do, you'll be done and you'll be an expert on the subject. So, the other thing I think it's important to say is that the roadmap is not just an academic exercise. It's not occurring in a vacuum. In fact, it's occurring at a moment of dynamic change in the health sector and a lot of positive developments despite the COVID-19 pandemic. So in the middle of the pandemic, we have seen the National Health Service in England commit to zero emissions by 2048. That's the largest national public health service in the world. We have seen hospitals and health systems in the United States make similar commitments, major systems in the US. We've seen the government of Argentina put in its nationally determined contribution to the Paris Agreement, commitment to measure its health sector's greenhouse gas emissions and begin emissions reduction. And we've seen a series of other actions and initiatives that I'll talk about in a little while. So the roadmap is coming in the context of a growing groundswell, a growing movement of hospitals and health systems, national and subnational and local, that are taking action towards zero emissions, toward greater resilience, while at the same time serving as anchors for their community and promoting health equity. So that's the context. Now let me talk to you a little bit about what the findings are of the roadmap. So that little blue dot that you see on the slide there at 2 gigatons is the 4.4% of global emissions from the healthcare sector. That's the finding of Green Paper 1 in 2014. What we found when doing the roadmap is that if you project out a business as usual scenario healthcare's climate emissions more than triple and would reach 6 gigatons per year by 2050. That's business as usual. That's the bad news. The good news is that if you take all of the government's commitments that they've made around the Paris Agreement and the commitments that they've made on climate up until 2017, you would reduce those emissions to 3 gigatons. So you would reduce a significant amount of that growth just through existing government climate commitment. But you would still have an increase of 50%. You'd still have big growth in healthcare's climate emissions, even if governments were to meet all of their Paris commitments so far. And we know that governments aren't yet meeting all of those commitments. So the good news is those commitments are there. We'd have a significant reduction if we got there. The bad news is we need to, as the health sector, if we want to see healthcare's footprint reduced, we need to make sure our governments actually fulfill the commitments they've already made. Now, what we've identified is 7 high impact actions and 3 pathways that I'll talk about in detail in a minute that would further reduce healthcare's climate footprint and take it down and cut it in half or more than in half by 2050. And we've been able to model these actions and identify the kinds of reductions that can be achieved. Altogether, cumulatively, it would save 44 gigatons of carbon emissions over that time period. And to give you a sense, it's really hard to understand what that means, but it's the equivalent of keeping 2.7 billion barrels of oil in the ground every year for 36 years. Or another way to look at it is that those 44 gigatons are all of the greenhouse gas emissions of the entire world in 2018. So that's a significant contribution that healthcare can make if it moves toward decarbonization. Yet it's still not enough. And so there's this other area that we're calling uncharted territory, which are a series of other actions that the healthcare sector will need to innovate and create in order to get itself on the path to zero emissions and to align with the ambition of the Paris Agreement. So that's sort of the core finding of what needs to happen that the roadmap has established. One of the other findings that we came up with here is that fossil fuel combustion is the dominant source of healthcare emissions. 84% of all healthcare emissions across the various pathways from the healthcare operations and delivery to the global supply chain to the broader societal production that underpins healthcare. 84% of that is from fossil fuel combustions, making energy for hospitals, transport for hospitals and health systems, producing pharmaceuticals, producing plastics, producing building materials. All of that is powered by fossil fuels. So what that means is one of the bottom lines here for the healthcare sector is that if we're going to protect public health from climate change broadly and stop air pollution and address the climate crisis, we need to move away from fossil fuels. But also, if we're going to decarbonize healthcare and do our part, we also need to move society away from fossil fuels. So it's a double imperative for the health sector to move away from fossil fuels and toward clean, renewable, healthy energy across all of the different ways that healthcare produces emissions. So the other thing that we tried to do, and this is sort of the key innovation of the roadmap, is to begin to chart a course to zero. So it sets a vision, the roadmap does, and a strategy for the sector to get to zero emissions while achieving greater health equity and climate justice. And it identifies that everybody needs to play a part, from health professionals who prescribe pharmaceuticals and who make daily choices about the products that are used, to engineers in hospitals who need to make the best use of renewable energy and efficient technology, to health policymakers and decision makers who can put in place policy and financing to facilitate the implementation and utilize the reach to focus more on sustainable models of care, to medical students who are up and coming in this profession, who are going to be the leaders of the future, who are going to inherit the planet that we are passing on to them, but also who are going to be in the leadership of the healthcare sector in the future. And of course, all of us who are patients and people concerned with the sustainability and the health of the planet, by making sure our voice is heard. So in charting this course to zero, we've established 3 pathways, 7 high impact actions, and a set of recommendations. And I'm going to walk you through those now. Oops, went the wrong way. Okay. So first of all, and also we identified 4 trajectories. So I'm going to talk about the trajectories first. And this is really important. As I said at the beginning, and as we all know, the world is a very unequal place, both within countries and between countries. And we know that there are certain countries, like my country, the United States, that are the most responsible for greenhouse gas emissions historically, and the biggest polluters currently. So, the biggest healthcare polluter in the world that we found in Green Paper 1 is the United States. European Union, China, also huge polluters. But what we found is that, or what we recommended is that the biggest polluters, the ones who have the greatest emissions, have to make the biggest changes the most quickly. And so we've created 4 trajectories based on GDP. So the wealthiest countries must make the change the most quickly. And then there are 3 other trajectories, so that some health systems may need to grow in order to provide health for their populations. And some health systems need to develop in that way. And so their emissions may grow over the next few years. But all health systems need to act, and need to act quickly to begin to make the transformation to decarbonization. But it needs to be done in this context of global climate justice, where we recognize the inequities of the world and that there are different trajectories for different countries of different levels of development. And so these trajectories are fully explained in the roadmap. Now, we also identified 3 pathways. And so if you remember this graph, that top part, that blue part, is what governments can do, or if governments meet their commitments, you have that emission reduction. And then that next maroon or purple wedge is where the 3 pathways and these overlapping 7 actions need to be established. And so the first pathway is decarbonizing healthcare delivery, healthcare facilities, and healthcare operations. So actually decarbonizing our hospitals and how they operate. The second pathway is decarbonizing the global healthcare supply chain and its local impacts as well. So that means everything that is produced by and for healthcare, and by the pharmaceutical companies and the medical device companies and the PPE companies and all the rest. And so that has to do with what healthcare purchases, as well as what healthcare that these companies produce and how they produce it. And then the third pathway is accelerating decarbonization in the wider economy and society. And again, as I mentioned, this is really important in that a lot of the production of energy, for instance, in the broader society contributes to healthcare's footprint. And so if we're going to move away from fossil fuels, healthcare needs to actively advocate for that broader decarbonization in order to decarbonize its own operations. And we're able to model the percentage of that exists as well. So let me give you some examples of how that works through the 7 high impact actions, which also sit in that same wedge. So across those 3 pathways, there are 7 actions that we've identified that healthcare can take to move toward greater decarbonization and resilience. So there they are, 7 actions. Okay, so the first action is to power healthcare with clean, renewable electricity. So how does that work across these 3 pathways? It means hospitals and health systems purchasing renewable energy and installing renewable energy on site. It means the supply chain being produced with renewable energy. And it also means the broader society, that third pathway, producing renewable energy that powers hospitals and the supply chain as well. So it means the actual health system integrating renewable energy in its operations, the supply chain integrating renewable energy, and the broader society doing so. The second pathway, or second high impact action, is the largest contributor of all different healthcare operations that we model to to climate change, and that's buildings. And so what we need to do is invest in and innovate zero emission buildings and healthcare infrastructure. We've calculated that if we were able to do this between now and 2050, it would reduce healthcare's emissions by 17.8 gigatons, which is the same as all of the climate emissions from the countries of the United States and China combined in 2018. So developing sustainable zero emissions buildings that are fit for purpose for healthcare in the 21st century is a cornerstone action. And that means we've got to change the way that our buildings are used and designed, the way they're built, and the materials that are used, as well as the wider infrastructure they rely on. And so this also links to where they're located, the size of buildings we create, and how they support communities. And there's a lot of examples of this happening already. So the NHS is committed, for instance, to making sure that their 40 new hospitals that they're building will be net zero. Australia's National Capital Territory has also made a similar commitment for a new hospital it's building. And there are examples of hospitals and health centers across Asia that are being built with environmentally sustainable materials and designed to be energy efficient and to run on renewable energy. Another key element of this is building refurbishments and retrofits. Since most buildings that are in place now will be there in 2050 as well. And so achieving zero emissions means reorganizing those buildings so that they are also moving toward net zero. The third high impact action is a transition to zero emissions and sustainable travel and transport. And that means moving both toward sustainable ambulance fleets and hospital fleets. And again, for instance, the NHS is going to be investing in hydrogen ambulances. And so electric vehicles and are part of the future, but also in active transport. The fourth high impact action is to provide healthy, sustainably grown food and to support climate resilient agriculture. So that means food that is local, sustainable, and plant forward that can ensure a contribution of close to a gigaton of emissions reduction between now and 2014. And that's the equivalent of the emissions of two countries like France and Germany right now in a year. So again, moving towards sustainable food can help and reduce emissions in a significant way while providing better health for communities and better health for patients and staff that consume that food. The fifth high impact action is incentivizing and producing low carbon pharmaceuticals. This could save 2.9 gigatons. That's equivalent to the emissions of Russia and India in 1 year. So this is like a health specific intervention. The way medicines are prescribed is changing how they're prescribed to moving toward greener pharmaceuticals, and the infrastructure that supports the manufacture, dissemination, and waste management of these products is a key part of the roadmap. From developing these greener pharmaceuticals to prescribing lower impact medicines or increasing the levels of social prescribing, every health professional in the entire pharmaceutical industry has a role to play. This includes moving toward low carbon or zero emissions inhaler propellants and anesthetic gases. Okay, high impact action 6 is to implement circular healthcare and sustainable healthcare waste management. And so really applying the principles of circular economy to procurement and production can have a significant impact as well. And finally, last but not at all least, is establishing greater health system effectiveness. And that means having more efficient delivery of care. So in some countries, care is very wasteful and delivered very inefficiently, such as in the United States. And we've calculated significant savings that if we can just become more efficient in how we deliver care in different parts of the world, we can reduce healthcare's footprint in a significant way. So those are the 7 high impact actions, altogether 44.8 gigatons. Again, that's the entire world's greenhouse gas emissions in 2017, if we were able to achieve those across the 3 pathways of operations and delivery, supply chain, and the broader society. And there's still that uncharted territory. There's still more that we need to do. And so there's a lot to explore in terms of being able to better model some of those actions, but also to begin to implement new strategies like green universal health coverage, moving more to telehealth. And these are things we were not able to model in the roadmap, but that we've identified as important actions. Better and more sustainable emergency preparedness and pandemic response. Disease prevention is climate prevention. So we've modeled a significant amount of emissions reduction if we can reduce tobacco, reduce the consumption of meat, reduce air pollution, reduce obesity. All of those health interventions, if we're successful at them, can also have climate co-benefits. So there's a series of different actions to transform healthcare that can help get us all the way toward zero emissions. All right, so almost done here. So there are a set of recommendations for driving change for national governments, for UN and other international organizations, for the private sector, and for civil society that are in the roadmap. And there's the last thing I want to do is share with you a little bit about the forward momentum, the stuff that's happening. Again, this roadmap's not happening in a vacuum, but there's a lot of really positive movement toward implementing some aspects of the roadmap in the lead up to COP26 in Glasgow in November, as well as on the ground with different hospitals and health systems. So I want to share with you 3 different examples. So first of all, there is a partnership between the COP26 presidency, which is the UK government, the World Health Organization, Health Care Without Harm, the UNFCCC, and the Greener NHS to seek commitments from national governments on resilience and decarbonization. And you can see on the screen what those commitments are. And in fact, today at 2 p.m. Jakarta time and 3 p.m. Manila time, the WHO is organizing a webinar around this partnership to seek these commitments from governments in the lead up to the COP. And so this is, if you look at what these are, this is, in a sense, how we begin to move national governments to take on the roadmap and build their own roadmaps in the context of this global trajectory of decarbonization and resilience. So it's really exciting to see this happening. And we hope that the roadmap is that navigational tool that can provide the framework for these kinds of commitments, and then their implementation, which Health Care Without Harm is building a framework and a methodology to support in the coming years. Secondly, some of you may be aware that Health Care Without Harm is a partner with the UNFCCC for Race to Zero. And we just announced the first cohort of 40 healthcare institutions representing the interests of more than 3,000 hospitals and health centers in 18 countries on every continent in the world that have joined Race to Zero and have made a commitment to zero emissions healthcare. So again, the roadmap is there. It's not an academic exercise. This work is happening. It's happening at the national government level. It's happening at the health system level and for non-state actors. And we also will be sharing with all of you and our network around the world a tool that will support hospitals and health systems as they try to move toward climate smart healthcare, to low carbon and resilient healthcare, to measure their carbon footprint in order to be able to take action on it. And so that tool will be available beginning in July. So just to close here, as I mentioned at the outset, the roadmap is designed to be a navigational tool for transformational systems change. It underscores that it is imperative that the health sector seize this moment and provide the climate leadership the world so desperately needs. And while there is no vaccine for the climate crisis, prevention and preparedness, 2 fundamental healthcare principles, are what can help save the day and deliver healthy people on a healthy planet. So thank you so much, and I look forward to hearing the thoughts of the panelists.
All right. Wow. Very exciting times for everybody. Josh, thank you very much for such a comprehensive outlook and coverage of where the healthcare industry can go. It's very interesting to note, and also disturbing, that even as we give and are given healthcare as a thing that we have to do, we are also spewing the pollution that comes with it. So, we have to think twice. Are we healing, or are we killing the people that we're supposed to be healing, right? So I guess the call of Josh and for everybody is that there should be transformational health, as that slide was saying, and shifting from transactional health, right? So, and that is going to be the choice that we have to do in the next race to zero, 2050, as Josh was saying, if the healthcare industry can really contribute to helping the environment heal itself as we heal also our people. So thank you, Josh. And we look forward to more of this and more in-depth studies that will follow because of this presentation and this opening. In this next part of the program, I'd just like to say that, there are right now 53 participants who are with us right now. And we'd like to thank everybody who have joined in and are still with us as we continue on with this launch. We look forward to having you in future discussions about this so that we can tease it out some more and see how we can all help out in our healthcare with reducing our carbon footprint. Yeah, let's learn more about the roadmap and how this can be implemented in our region, specifically Southeast Asia. And with that, let me introduce our panel of speakers to give their 5-minute reactions or inputs to what Josh shared with us. The first is Owen Jenkins, who is presently the British ambassador to Indonesia and Timor-Leste. The second is Dr. Joanna Vegert. We call her Yo-Yo. She wants to be called Yo-Yo, who is the WHO WePro Climate Change Technical Officer. The third is Dr. Rohaida Ismail. Dr. Rohaida is a public health medicine specialist. She's the head of climate change of the climate change unit of the Institute for Medical Research of the Ministry of Health of Malaysia. And fourth is Dr. Reynaldi. He is a doctor champion for RISE Alliance, RISE Alliance for Health and Climate. Also he is also from Indonesia, also in Southeast Asia. And last but not the least is Madame Shi Lun Wei, who is our Deputy Director General for Health Promotions Administration of Taiwan. To all our panelists, welcome and thank you very much for sharing of your time. We would now want to hear your reactions to what was presented by Josh. Let's start off with Sir Owen Jenkins.
Health systems in Europe, Southeast Asia, and around the world have faced huge pressure from the COVID-19 pandemic. In some cases, they have simply been unable to cope. As governments in developed and developing countries have scrambled to meet the immediate challenges, it's important that we also take into account the relationship between climate change and health. Climate change represents a major challenge for public health. We're increasingly seeing the vulnerability of both our health systems and whole communities to climate-related events. A recent WHO report on short-lived climate pollutants, black carbon, ozone and methane, estimates that global measures to reduce these pollutants could result in 3.5 million lives being saved annually by 2030 and between 3 and 5 million lives annually by 2050. And this is alongside the climate benefits. There's also a clear link to global health security, the risk of zoonotic diseases crossing over, shifting disease vectors, and so on. Climate change is a key driver of health inequalities. Age, gender, social deprivation, and pre-existing conditions are key determinants of the impact of climate change on health. The most disadvantaged in our societies and globally are often the most vulnerable to poor health outcomes from climate change, and they have the most limited ability to adapt and to respond. Health systems are essential in protecting our populations from the negative impacts of climate change, including extreme weather events, flooding, food and water shortages, and reduced air quality. But health systems themselves are also vulnerable to the impacts of climate change and can be compromised when they are needed most. So, the importance of resilient health systems is clear, protecting our populations from climate-related events driving the response to global health security threats, and delivering essential health services to our populations so they can tackle preventable deaths of mothers, newborn babies, and children, among others. As part of a green and resilient recovery, we also need to recognise the role of health systems as emitters, accounting currently for 4 to 5% of global emissions. Whilst health sector emissions are lower in low and middle income countries, these are projected to increase at rates that will make the Paris Agreement targets difficult to achieve. So it's important for all countries to develop plans for implementing low carbon as well as resilient health systems so that they are aligned with the ambition of the Paris Agreement. In recognition of these challenges, we are pleased that COP26 will have a strong health focus through the COP26 Health Programme. In May, the UK COP26 presidency, with our government and non-governmental partners, launched 2 initiatives of the COP26 Health Programme. The first is climate resilient health systems, and the second, sustainable low carbon health systems. The focus of the second, the low carbon sustainable health system initiative, is for countries to make a commitment to develop an action plan for a low carbon and sustainable health sector, which links to their national emissions reduction plans. Ideally, and where appropriate, countries should also commit to reaching net zero by a specific target date. The aim of the Climate Resilient Health System initiative is for countries to make commitments to carry out an assessment of the vulnerability and adaptive capacity of their health system to climate change, and to address their vulnerabilities in a corresponding national plan of action. Healthcare Without Harm have been a key partner in the development and delivery of the Sustainable Low Carbon Health Systems initiative. Their roadmap is a useful tool in helping countries understand how they can grow and strengthen their health systems in a way that will minimise carbon emissions as they develop, whilst also ensuring that the system can ensure to protect our populations as we increasingly suffer the impacts of climate change. In Southeast Asia, as in other parts of the world, it's important that we address both the resilience of our health systems and the emissions they're responsible for together. The roadmap provides a strong foundation for us to work from. I would like to thank Health Care Without Harm and their partners for the work they have put into developing and disseminating the roadmap. I commend it to you as a user-friendly tool for countries to plan their health systems in such a way that health is part of the solution to the climate crisis, while still delivering good health outcomes for our populations. I want to end by urging you to take the opportunity that COP26 presents us with to drive forward real change on climate change and health by supporting these initiatives on climate resilient and sustainable health systems and on low carbon and sustainable health systems. Thank you very much.
Thank you very much, Mr. Owen Jenkins. Let's hear now our panelist, Dr. Yo-Yo Vegert, for her reaction.
Thank you very much, Dr. Glenn. So first of all, I'd like to congratulate Healthcare Without Harm on this tool, as everyone's been talking about, or roadmap. To repeat others, it is very comprehensive, a significant piece of work at this time. It includes things like the status quo, modelling the emissions, and the policy recommendations which WHO is working alongside and will take up as well. And then it includes actions as well, including, I just wanted to point out, for the private sector, which I'm particularly passionate about. And it's a good follow-up from the 2018 document on carbon footprint. So WHO has been as a good partner of Healthcare Without Harm, and I would like to mirror Josh's presentation and the document as much as possible for the region of Western Pacific. So WHO has been complementing this by mainly working on resilience and sustainability, environmental sustainability. And in recent times, it's become more evident, or the sustainability has expanded for WHO into the carbon footprint. of the healthcare system. And some talk about low carbon emissions or hopefully decarbonization. And I just want to point out that there are two documents which the roadmap points out, which is the guidance on climate resilient and environmentally sustainable healthcare facilities, and the document access to modern energy services for healthcare facilities, for health facilities in resource constrained settings. So these, along with other resources, are ways in which the roadmap can be implemented so that it isn't just an academic, and as Josh says, it's not just an academic, but things are going on and this is just a complementary tool or complementary document. So from the WHO's approach, we see that the decarbonization works on 3 levels. It promotes health by reducing air pollution. It protects health by reducing risks to climate change. And it makes the systems more resilient, systems and facilities more resilient and sustainable. And I just want to add, within that, there's health and well-being. WHO talks about health and well-being, and of course, the economy and creating green jobs is a huge, significant impact on the livelihoods and therefore the productive livelihoods and the well-being of humans, and by creating green jobs. So just to make aware that there's a new guideline from WHO on the climate resilient and environmentally sustainable healthcare facilities, which synergizes with this roadmap on decarbonization, health equity, and resilience. And then we've also got the WHO manifesto for healthy recovery from COVID, which is very specific for this time. And in which I'll just point out 3 areas where we complement again, or not we, but the world is complementing these initiatives, is to shift to clean energy, build livable cities, and stop subsidizing pollution. And thereby we would be preventing and preparedness and equality, working on equality. So in WIPRO region, which is the Western Pacific region, WHO have a document called For the Future, which is our strategy. And in that, we call for the health sector to address its own contribution to carbon emissions and environmental degradation. And we ask the health sector to lead by example, which is exactly what this roadmap shows and is saying. That because we're in a region where China, Korea, Japan are high emitters, but then we have Pacific Island countries where the emissions don't make a huge contribution. But that's particularly significant where we can say lead by example. But then also, I just want to say that, as the report does, the emissions work on various levels. So it's not just the facilities in one space, it's the operations of the procurement, and going out widely, the transporting of the drugs, the medicine, the bottles, the plastics, and so forth. So all of that contributes. So the other area which is WIPRO is contributing, and entry points for countries to work with, is the SIDS initiative, which has a vision that by 2030, all systems and SIDS will be resilient to climate variability and change, which must happen in parallel to reducing carbon emissions. The Global Environment Facility, we have some projects in Cambodia and Laos, which are primarily about resiliency, but also consider energy efficiency. And then we're currently doing 2 proposals for readiness for Laos and RMI, which includes capacity building, training, and awareness raising of the NDAs, the national designated authorities, the other ministries, and the health ministries to bring to their attention this carbon footprint of the healthcare system and what they can do about it, and the health co-benefits of climate finance. And then just to bring a final word, there's it's called a final word in the report. And I just want to read a little bit. It says, transformational change often does not occur in a linear fashion. Rather, it happens rapidly and with little warning. We must urgently forge this burgeoning drive for change into an all-inclusive worldwide movement for healthy people and a healthy planet. The health sector must help lead the way. And so I think that should have been almost poetry when I read it, not as I read it, but in the book, in the roadmap. That I think people who are on the webinar today agree this needs for a transformational change. We are calling for change, and we're learning how we can do it and in what ways, entry points. But sometimes it's the mindset, and sometimes we come across mindsets and they're saying, can we do it slowly? Can we work within what's comfortable for everybody? But actually, I don't think it's up to us to modify the message or modify the change into being non-transformational. There's no excuse but to make a transformational change, and I think that will happen with or without many of these people on board. So I think they can sometimes wake up and see that it's happening, and so it's good to keep the message going strong that it has to be transformational change. And that's it. Thank you so much.
Thank you very much, Dr. Yo-Yo. And I'd like to call on our next panelist, Dr. Rohaida, for your thoughts.
Okay, thank you very much, Dr. Glenn. Good morning, everyone. First of all, I would like to congratulate Healthcare Without Harm for the Southeast Asia networking and the launch of this roadmap for healthcare decarbonization. I am in the research wing of the Ministry of Health, and my work is basically on the public health impacts of climate change. And if we look at the scientific evidence, we can see how climate change is impacting human health in many ways. So climate change actually would increase the probability of increased temperature, extreme droughts, and risks related with water availability in some warmer regions, and particularly in Southeast Asia. And if we look at the IPCC report in 2018, it highlighted that the Southeast Asia region is highly vulnerable to increased flooding in the context of sea level rise and heavy precipitation. And these extreme weather events leads to increased risk of temperature-related diseases, particularly the climate-sensitive infectious diseases. And globally, the risk of some vector-borne diseases are projected to be increased with global warming 1.5 to 2 degrees Celsius, with some potential shift in the geographical range. And risk of climate-sensitive health outcomes, such as diarrheal and food waterborne diseases, are related to water and sanitation systems, particularly during and after extreme weather events, such as floods and droughts. And we at the Ministry of Health Malaysia have reacted to the effects of climate change. Our national plans were developed to provide common framework for action in the implementation and strengthening of the international health regulation for detecting, preparing, and responding to infectious diseases. But it is also as well as the response and preparedness to public health emergencies, including the natural and climate-related disaster and extreme weather events. And the integrated vector management and surveillance of vector-borne diseases are directed in our national strategic plans. And the updated plans are being strategized through surveillance system, the early warning, detection, treatment, prevention, and control activity, as well as the social engagement and communication and enforcement. Our Ministry of Health also prioritized in making climate resilient healthcare systems to ensure continuous uninterrupted health services being provided, especially during or after climate-related disaster. We did some assessment on healthcare facilities' vulnerability to climate change within river basins in Malaysia in 2018, with the projection of precipitation and sea level rise by 2030 and 2050. It showed that some number of healthcare facilities are vulnerable to climate change. And adaptation measures are being adopted by the Ministry of Health to enhance and sustain health services, to strengthen the preparedness, response monitoring, and disease surveillance, and to support capacity building. The Ministry of Health also have initiated the Sustainable Framework for Safe Environment and Green Building for our healthcare facilities, which is led by the Engineering Services Division. And I believe that this global roadmap for healthcare decarbonization by Healthcare Without Harm would be a useful tool to complement current efforts from the health sectors on low carbon and climate resilient healthcare initiative. And last year, the Healthcare Without Harm Southeast Asia had launched a networking, which is the RISE Southeast Asia Alliance for Climate and Health. And we also involved in this networking, which established an alliance of health and climate, and to bring together various stakeholders in Southeast Asia. And this is to ensure the climate action have equity, resilience, and also have recovery are integrated and prioritized in Southeast Asia climate change action. Okay, that's all from me. Thank you very much, Dr. Glenn.
Thank you. Thank you very much, Dr. Ismail. It is very interesting to note that, Dr. Ismail was already sharing what her country is going to do in the 7 high impact areas. And that's where we want to bring and direct the discussion towards, because it's very important for us now to act individually as countries on how we would like to make that roadmap something that's doable and something that we can look forward to, even as we look at our health systems in our countries. Right. So let's move on and let's see what Dr. Rinaldi has to say. Dr. Rinaldi, yours. The floor is yours.
Okay. Thank you, Dr. Glenn. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Alhamdulillahirrahmanirrahim. Allahumma shalli ala sayyidina Muhammad wa ala sayyidina Muhammad. Good morning, everyone. Selamat pagi. Magadang maga. First, I want to greet all of our fellow racer in a race towards zeros. We are racing together in this race, not as a competitor, but as a fellow partners. We are standing here and have meetings today with our fellow speakers, Sir Glenn, Sir Jos, Dr. Joyo, Madam Sin, and Dr. Ismail. It's really happy to meet you all today. And also from our national organizations and international organization, which is government ones or NGOs ones, and also our future leader that also attends these meetings today, from International Federation of Medical Student Association, from Indonesian Medical Student Associations, our future leaders, Hidup Mahasiswa, and also from our Perluni Tiongkoks. It's really nice to have this healthcare decarbonization roadmap finally launched. We already discussed it several months before, but to have it officially launched, it gives us more encouraged spirits to move together. Then this will spreading our horizons more widely, that our carbon emission is not only restricted to what plastics. The 7 high impact actions shows that the carbon emission is everywhere. It can happen from every act that we take in our healthcare systems. It's not only in plastic package. It's not only in plastics on essential, non-essential uses like drugs package and also straw using in hospitals. Not only that, but even the energy that we use, the electricity that we use, the heat and the gas that we use to heating our waters for the patient's bath, etc. It's also make a carbon emissions. Not counting elsewhere the supply chains in our healthcare procurements. our pathway to bringing foods towards our patients, bringing drugs from the manufacturer, from the pharmacist toward our pharmacy, toward our drugstores. It also make carbon emissions. And more or less that something becomes more big impact out in pandemics era is the hospital designs. We are to comfort with air conditioner. We are to comfort with our air manipulations, with a closed hospitals, like a office one, like a closed building one, with lack of natural ventilation, lack of natural lighting, and we pay the cost today. When we hit by the pandemic, we need to install air purifications, air purifier. We also need to change the layout of the hospital. We also need to change our air circulation systems because we neglect it before, and it costs us more. So this 7 high impact really open our minds, and we know where we should start. I try to quote what our teachers and our leaders, Gary Kahan, said in a previous meetings in schools, Sweden 2 months ago. We cannot have a healthy people in a sick planet. So I also add what Dr. Glenn said in the opening of these meetings, to keep our patient healthy, to give our best effort on our health systems, we have to help the planet first. We also have to consider the planet health because we cannot have a healthy people in a sick planet. So how to make it work? How to make these healthcare decarbonizations roadmaps give more impact? I give two quotes on it. It's in cohesion and cross collaboration. The cohesion need to be built in the health community itself, from the clinical practitioner, doctor, nurse, midwives, other clinicians, and also health facilities from the smallest, from the primary healthcare, private clinics, to the big one, to the provincial hospital, national hospital. We cannot move it part by part. We have to move together. Unfortunately, not all of us are aware with it. Not every hospital, not every healthcare facilities even counting their carbon emissions per month. They're not counting their tonnage of waste, of domestic waste. They're not counting their plastic usage in medical waste. They not try to reduce it because they don't even know how much carbon they emit every day. So I really get that Global Green Hospital as well make a new carbon calculator, so all of us can calculate it and give it to our government so they can make a good regulation for us. We have to involve our government too, and not counting less. We also have to involve our medical students, our nurse students, because they are the future leaders. Like hospital business never been taught in the universities, and also the sustainabilities. So, well, we have to move together. We have to build a cohesion in the health community first, and then make a collaboration with other cross organization outside health facilities. Because when we make a meeting months ago with with provincial governments, the other participant from outside health, it's not even considering health as a big emission of carbons, big emittance of carbons that even counted. They include industry, they include how to say other business sector, energy sector, but they not count healthcare. So we have to open their mind that if one hospital make a small carbon emissions, but if there are 1,000 hospitals in one province only, the carbon emission impact is great. In the last minutes, I'm going to make some additions. Our major studies now are working towards sustainability. We learning about financial sustainability now, development sustainability, business and economic sustainability, and capital sustainability. Now it's time for hospital and healthcare sustainable. We have to move from just effective, efficient. Plastic is effective, plastic is efficient, but we have to move toward the sustainable. So we have to make a new jargons now. 3 words: effective, efficient, and sustainable. Thank you, Dr. Glenn. The 5 minutes is up. Thank you.
Oh, so you have your old timer there, huh?
Yeah,
Yeah.
because I've already more than something.
Thank you very much for keeping within the time. But thank you very much also for sharing so much of what's happening right now in your part of the country. And we do look forward to that. Even as we discuss later on in another part how we can do this in the 7 high impact areas, I'd like to welcome now our next speaker, Madame Shi Lun. She gives her part of the reaction to the roadmap. Madame.
Good morning, Dr. Pastel, Mr.
Morning.
Pascal, Mr. Carolina, and everyone. Thank you for your introduction. I would like to share with you on what we have done to help our healthcare institutions mitigate and reduce the threats of climate change to health. First and foremost, the promotion of population health is the core duty of the Health Promotion Administration. In order to assist our medical institutions to lessen their impacts on the environment and indirectly affecting the health of people, we advocate for hospitals to treat this issue seriously and to encourage them to adopt an energy and carbon reduction plan that incorporate multiple dimensions such as energy saving, include power and water, reduction of medical waste, and green procurement. We emphasize that the need for medical institutions to devise an emergency response plan and the related procedures for climate change-related risk management, to advocate disaster prevention and response mechanisms for climate change vulnerable populations, and to ensure sustainable operation is achieved without compromising on the quality of medical care services. As mentioned by the roadmap published by Health Care Without Harm, healthcare institutions are one of the major sources of carbon emission. Hospitals need to promote strategies to reduce their own carbon emission and energy saving. That's why it's important for hospitals to promote environment-friendly and energy-saving actions via top-down approach and build up capacity for mitigating and adapting to the effects of climate change on environment and health. Corresponding to their individual service level, for example, medical centers or regional hospitals. Going forward, we want to communicate more with our hospitals on their stance of the important subject and to assist them with existing mainstream energy saving and carbon reduction measures so that we hope we can minimize additional burden on medical institutions. Thank you very much.
Oh, wow. Thank you very much, Madam Shi. You were well within the 5 minutes. And we would like to go into this next segment because I know that quite a number of you already have shared what you're trying to do in your countries and in your health systems. What we would like to, I know also that some of you have already said one of the impacts that you're trying to do, right? With the 7 high impacts, I should say. How do you think the roadmap can help the healthcare sector? Specifically, right? There are 7 high impact areas. So how do you think, we can take the leadership in meeting the challenges of these 7 high impact areas, specifically in your areas, in your countries? Yeah, let's take who would like to take a first bat at that. In the Philippines, right? I'd just like to share a quick one. In the Philippines, there are quite a number of things that we're doing right now. We're looking at health care and hospital waste management audits, right? That's one thing that we're trying to do because as part of the 7 high impact actions, I think that's in looking at number 6, which is circular healthcare and sustainable healthcare waste management. This is also mentioned a while ago by Dr. Rinaldi. But what we're trying to do now is to get our hospitals to start off with auditing our healthcare waste, so that we see in conjunction with what do you call this? In conjunction with what we're trying to do in the Philippines. Maybe we could ask Engineer Philip also to say a few things about this. If he's available, if he's not, maybe it's going to be in the chat that he's going to say for this in the DOH. But even so, let's continue on. What do you think is your reaction to the 7 high impact actions in your area? Any of you? Let's go back to Dr. Rohaida.
Yeah, Dr. Glenn, if you look back to 2019, air pollution and climate change are the first in the WHO list of 10 threats to global health, and
Right.
others would the global influenza pandemic and vulnerable settings and others, in which the Ministry of Health and various stakeholders are working together to promote health, to keep the population safe and to focus the vulnerable. And in the 7 high impact actions, which was outlined in the roadmap, it is the first 3 parts. I think the first 3 high impact actions is actually on zero emission. It is very much support the climate action. And if you look at the identified pathway, the 3 identified pathway to navigate, which are decarbonize healthcare delivery facilities and operation, and then the supply chain, and we go to the wider scope of economy and society. So this part is very much helpful in the addressing the emission. And for our Ministry of Health, these are also part of the key milestone for the sustainable framework and green strategy of healthcare. And like I have mentioned before, we have the programs that are being strategized as the climate smart healthcare, with the sustainability program and engineering technology towards low carbon and green strategy for health sectors. It is actually being led by our engineering division, but the focus now currently in a few hospitals, and we hope in the future we have more hospitals to join in the program for the sustainable framework and green strategy of healthcare. Okay.
Thank you, Dr. Rohaida. While it's true that in our country it's air pollution, it's not only in your country; it's in all our countries. But it's good that that is what you're going to look at, and specifically, you are looking at your sustainable framework. So this is in answer to the 3-pronged approach that Josh shared with us, and we do look forward that more hospitals come into your ambit. So that they can look at climate smart hospitals being part of that answer and response to the roadmap. Yeah, thank you very much, Dr. Rohaida. Maybe Dr. Rinaldi, you can also share your thoughts on how do you think this roadmap can help your part in Indonesia as we take the leadership in meeting the challenges of the climate change crisis and the pandemics.
Thank you, Dr. Glenn. So, like what I said before in my opening speech in the 5 minutes before, how to make this? Will this roadmap give us the good additional support? Yes, it will, because it will open that we are not concerning about plastic only or packaging only. The biggest and the number one from the 7 high impact actions is energies, right? And it's counting the more of it. But unfortunately, energy efficiency and hospital structure renovations and change is the high cost, the most costly program to take, and the hardest one to also for the taking. But the first step towards that movement is to make the awareness, make the carbons count, make everybody counts their carbons. So that's why I really supporting GHH and also HCWH to have the new calculators that will help the hospitals and other healthcare to counting their own carbon emissions, because we need to make a double approach, Dr. Glenn, from the bottom up and the top to bottoms. The national policies, according towards what they already signed for the Paris agreements, right, already make their national roadmap toward decarbonization. That we also avoid that it will also failing. That's why in this November we'll make another meeting in the United Kingdoms, right? Because they distributed these parts toward the how much the industry must cut off, how much the the retail have to cut off, and others businesses have to cut off. They not concerning our healthcare facilities as the carbon emitting business, but if we can meet them to make the national policies, and we also support it from bottom up, we'll meet it. We'll meet up theirs. So the hospital need to give their own data, their own importances toward these issues, so we can make it a good advocacy. And it starts from the decarbonization roadmap, from that 7 high impact actions. The easiest part to start actually is in sustainable procurement, Dr. Glenn. If the
Yes.
sustainable procurement is regulated in the national pharmacist regulations, in the national procurement regulations, like how we obtain our medicines, how we obtain our medical equipment, and also how we manage the waste of that equipment and inventories, it will give a better impact with little efforts and more efficient costs. Thank you.
Thank you very much, panelists. Maybe I can also ask right now, Josh. Josh, can you respond to some of the questions so that you can have more answers? And the chat box has been very busy, and maybe you can respond to them here.
Sure. I gave a couple of answers in the chat already, but I would like to respond to the last comment. I think that I think was very insightful from Rinaldi, if I pronounced your name right. I hope. In that this work has to happen from the bottom up and the top down at the same time. So the work that happens at the individual hospital level shows what's possible and makes change on the ground. And at the same time, in order to institutionalize that change, there needs to be policy that gets created and implemented at the national government level. So both are super important, and it's that's why we've created, for instance, this tool for hospitals to measure their carbon footprint and a series of resources for them to take action. One of which Yo-Yo mentioned, which is this guidance that WHO has created on climate resilient and sustainable healthcare facilities. All of that is really important, and it's really important for there to be a high-level governmental commitment to decarbonize healthcare as part of every government's national climate policy and national health policy. And so those two really go hand in hand. The roadmap, is trying to create this big vision of that transformation, and then Race to Zero is that race along the road from the hospitals. And what we heard from the ambassador is that the UK government is now leading this effort to try to get national governments to make those commitments. So I hope that he's the ambassador to Indonesia, and we've just heard from the Ministry of Health in Indonesia. I hope that given all the great work that the Ministry of Health in Indonesia is already doing, that Indonesia can be one of the leaders in Southeast Asia and be able to make that commitment from the top down, and that all that bottom up work can help reinforce it and support it. So if there are other questions that people felt like I did not respond to in the chat, I'm glad to respond more.
Right.
Yeah.
Yeah. Let's take it over to Madame Shilin. Maybe what can you say about the roadmap specifically for Taiwan?
I'm from health promotion field, but we understand that the total decarbonization of healthcare system is a challenging objective that requires collaboration with many professional disciplines. In the near future, we can produce education materials and good examples on the subject of 3 pathways and the 7 actions of the roadmap. Using poster presentations and advocacy videos providing knowledge for different subject groups, include service users, medical staffs, or facility engineers. These materials were designed to advocate how hospitals have contributed to the effects of climate change on health, and it can be used to increase the climate change and health literacy of personnel engaged in related affairs. We are very interested to hear from the speakers on how your nation is working toward this ambitious goal. Please share with us the obstacles you have encountered. Thank you very much.
All right. Thank you, Madam Shi Lun. No, it's very important that we look at media and health literacy towards the 7 pathways, and I think that's what she wants to look at specifically as health promotion. Yeah, we should be communicating properly the messages towards the 7 high impact actions. And maybe I could also hear a few words from Dr. Yo-Yo about how the roadmap, as you were saying a while ago, can also impact.
From WHO's perspective, as I said before, it complements, there's a synergy between WHO's work and this tool. Health Care Without Harm and WHO work closely together. And so I don't think I'll say anything groundbreaking in saying that we're working on the policy level, and then there's this roadmap, on how to get there. But also it works 2 ways, because we can pick up some of the policy recommendations, especially for this region, and try and guide the countries. I want to say that briefly that sometimes, again, talking about this transformational change and the mindsets, and because of that's the barrier which I'm encountering inside and outside the WHO, and so it's a good layout of the land of how it's not just the healthcare facilities, but it goes beyond that, and so more people in other industries can take responsibility and still relate it to health. And finally, I just want to mention the uncharted territory, that I think we're already starting to make headway with that by establishing green UHC. Not being WHO, but we as a planet, I think we're already taking steps, maximizing telehealth, and I'll say those 2 I'll pick out in particular. And of course, it does combine with the COVID manifesto.
Thank you. Yeah, it's really good to look at that part also, the uncharted territory. And there's still a lot to learn from that part. And we know that, they're going to be really part of improving effectiveness of our health systems. Mon, would you, you were raising your hand. Would you like to say something?
Thank you, Doc Glenn. There is this very early question as we were starting from Jesset Enanyo, having to do with how does the COVID-19 pandemic change affect the roadmap, and does Health Care Without Harm have recommendation particular for Southeast Asia healthcare system amid the pandemic? There is that portion in the roadmap, and I think it was somehow touched upon by Josh in his presentation. that the sicker the people are in our planet, then the more emissions that we emit out of the healthcare system. In reverse, the better well-being of our people and less diseases that are being experienced, like the pandemic, then that also means less emission coming up from the healthcare system. So, in a way that the pandemic is bringing in patients to hospitals, even to the point of saturating the capacity of our healthcare system. You can imagine, therefore, how much energy, electricity, water, medication, transportation has been used up just to treat and bring to end this pandemic. So, to your question, yes, that the pandemic brings about higher emission in the sense that it carries a lot of sick people into our hospitals. In the same manner that the pandemic caused some huge or bigger volume of plastic waste due to PPE, which is also produced out of the fossil fuel. Again, it even makes our climate change. It hastens the climate change. Therefore, to address the waste coming up from pandemic, we should be able to address the base by which the pandemic can be cured. So this is how it relates to the pandemic and the higher emission from healthcare system. The past 16 or so months, 1.5 years already. Thank you.
Very much,
Glenn,
Josh. Yeah,
Dr. Glenn,
can you say something?
yeah, just sure. Yeah, I mean, a couple things. So, I very much agree with everything that Mon just said, and I think that the pandemic has been a warning for us, for the world, and it's a warning about what the climate crisis will bring if we don't do something about it. And so, what it's taught us is that we need to be both pandemic prepared and climate smart in our health systems. And that is both it presents a danger, this crisis, but it also presents an opportunity. And the opportunity is to rebuild and transform our health systems out of this crisis so that they are pandemic prepared and climate smart, so that they are moving towards zero emissions and greater resilience, so that the next time there's a crisis, whether it be another pandemic or whether it be a climate-induced crisis or something else, our health systems are more prepared to respond. And that so our health systems are also not contributing to it. We built this roadmap during COVID. And we built this roadmap during COVID when many health systems were completely besieged by the pandemic, and yet some of them at the same time were making commitments on climate change. So I think it's not lost on the health sector that these two crises go hand in hand, and that you need to be able to, in a sense, fight two fires at the same time. And sometimes the strategies in fighting those two fires can be joined. So that's one response. And then Yo-Yo mentioned the uncharted territory and green UHC. And I think it's something that's really important for folks in the Southeast Asia region to think about. UHC is a major global health goal. It's part of the SDGs. And so if we're going to get coverage for everybody, we're going to have healthcare for all, we need to make that healthcare for all green and sustainable and zero emissions. And there's some really great innovative stuff happening out there in that regard. And so that's part of the transformational change as well. It's not just transforming the big hospitals, but it's how do we make how do we achieve that health equity and at the same time achieve climate smart healthcare?
Right. Thank you very much, Josh. And to all our speakers, again, thank you very much for giving of your expertise and your time. I know that this has been very fruitful for everybody as we, again, were able to glimpse and open opportunities and windows of action plans for looking at how the roadmap can apply to our specific conditions and how we can race to zero by 2050. Uh, can I just summarize some points as we close this segment, this program? Number one is that climate change and the public health crisis are actually linked. As someone was saying, and Josh was saying, as also Yo-Yo, you look at one, you respond to one, and you respond to both. So integrating, climate change and health really works. Number two, the roadmap addresses the crisis. Right? Can you imagine that we can actually limit and take out how many? 44.8 gigatons in 36 years to 2050 if we all do this together. So, if we look at healthcare decarbonization, we will heal both our people and our planet. So, but the other point is that this should be a health systems approach, and it should be now. Because if we don't do it now, we'll go beyond 2 degrees, and we don't want. We may not even exist at around that temperature range. Another point is that when we are able to decrease the vulnerabilities, then we are able to increase our global health security. So decreasing health vulnerabilities will increase our global health security. Rinaldi put up a very good point with saying that cohesion and cross collaborations. We are not competing against each other, but actually we're competing against ourselves, each one individually, in order to come and respond together to a health crisis as much as a climate crisis. I'd like to take note of Yo-Yo, as she said that policy should really be made as the cover to direct our actions towards the plans that we have. And thank you very much, WHO, for coming up with policies at the regional level in order to help us out with mapping and action for this roadmap. And, the opportunity really is there, as Josh was saying, to integrate health as a driver, right, to other sectors so that we can be resilient, climate-wise and health-wise. Right. And on that note, again, thank you very much for being participants also specifically for being with us this morning, I should say, afternoon or evening. And we would like to have a solidarity video message from some of our health and climate allies around the region. Thank you very much to Dr. Jonathan Hadlock from the Philippine College of Physicians, to Michelle Chowa of the International Federation of Medical Students Association, Asia Pacific, and to Nadia Zulfakar of Klima Action Malaysia. Pats, can we have the solidarity video messages right now?
Climate change from excess carbonization bears impact on human health, from extreme heat resulting to stroke and cardiovascular events, floods, droughts, vector and waterborne diseases. It also threatens the infrastructure of health systems and the management of public health. So, decarbonizing health systems therefore would result in an ideally responsive, healthy, and relevant constituents that can cut the cycle of environmental diseases, producing a healthier community that thrives in a dynamic climate, especially here in Southeast Asian region.
Southeast Asia is admittedly one of the most susceptible regions to the effects of climate change. We've encountered stronger typhoons, intense drought, and the continued rising of the average temperature of the region. As the environment is an important contributing factor to disease and mortality, the healthcare sector is gravely affected by these changes. A decarbonized and climate resilient healthcare system would entail a more sustainable and adaptable future. It would not only positively affect the healthcare system in terms of better preparedness, accessibility of services, higher quality of care, and better affordability, but it would also empower healthcare facilities to be more environmentally conscious and sustainable. Health and climate change are not straight parallel lines but a tangled web. Let us come together and save our Earth and our population for a better and a healthier tomorrow.
Hi guys, my name is Nadia from Malaysia. Climate impact is no longer the story of the future, guys. Southeast Asia is already one of the hardest hit regions. For example, in Malaysia, heat waves are more frequent, causing chaos in the human health. Morbidity is wide-scale and long-term, seen in the elderly, children, women, and those with existing chronic diseases, and thus adding pressure on the health sector. Social inequities already exist in the society, if not addressed, can further contribute to heat susceptibility. For example, often marginalized migrants working in the construction sector are affected by direct heat. Farmers facing increased heat stroke and yield loss threaten their livelihoods, and in the long run, so does our food and nutrition security. Extreme weather events also disproportionately affect rural women. Loss of traditional herbs and medicine caused by extreme weather events threatens the culture and the identity of indigenous people, and in some cases, women's access to sexual and reproductive health care. Friends, we need to urgently address the health sector's capacity to adapt to climate impacts. A health crisis is a climate emergency. Regional collaboration must share best practices, and from the private sector to the grassroots level. And this framework is one of the interventions that we urgently need to get us there. Thank you.
Great. So, at this point, we would like to thank you. Terima kasih. Maraming salamat. Sheshe to all our participants and guests in this virtual launch. I'm now passing the mic on to Claire Westwood, Healthcare Without Harm, Southeast Asia's Climate and Health Coordinator, for the closing remarks and final reminders. Again, thank you.
On behalf of Healthcare Without Harm Southeast Asia, I would like to express our deepest appreciation to our very capable moderator, Dr. Glenn Parasso, our esteemed speakers for their valuable inputs, partners from the RISE Alliance in Southeast Asia for Health and Climate, partners from our Global Green and Healthy Hospitals Network, video message and social media supporters, members of the press, and each and every one of you honored guests from Southeast Asia and beyond, for coming today to make this important Southeast Asia launch of our global roadmap for healthcare decarbonization a success. We look forward to working with all Southeast Asian countries on building a stronger, more sustainable, low carbon, climate and pandemic resilient healthcare sector in our region. For the journalists who are present, please key in your name and email address in the chat box so that we can send the press release and country fact sheets to you. If you are interested to join the RISE Southeast Asia Alliance for Health and Climate, please send an email to, it's in the chat box, infoasia@healthcarewithoutharm.org. And stay updated and get in touch. We are on social media, Healthcare Without Harm Asia for Facebook, Healthcare Without Harm Asia for Instagram, No Harm Asia for Twitter, and please visit our website as well. Our final gift to you today is a very moving song presented at the global launch of the roadmap in April. It is sung by Mia Kami, a musician from Tonga. She calls on the world to start healing the pain of climate injustice. So let's work together to heal and rebuild our world through healthcare leadership. Stay safe and stay strong, everyone. Selamat po, terima kasih, and siaseni.
Tell my story
through my original song called Healing. And this particular song, it speaks on how we as Pacific people, as Indigenous people, as people of color, our past is littered in hurt and oppression. And so the message of this song is that the healing process has started and it has to continue. We have to continue healing from the hurt of our past to ensure that our future generations can thrive in such a way that we might not have been able to in this current generation. But what I'd like this song to show is that we in the Pacific, we're on the front lines of this climate crisis. And while our healthcare is accessible and it's available to the majority of the population, this pandemic has shown that there are limitations on what's accessible to us. And so leaders must ensure that our healthcare systems are resilient in these times of change, in these times of this climate crisis, in these times of this pandemic. And so I hope this song speaks to you in such a way that it encourages action. And I hope that you like the song as well. Thank you again for having me. I hope you enjoy the song. I have a question. It's a little hard to ask, but even harder to get answers. I have a question. What if the roles were reversed and the victors didn't come first? Where would we be? Just because it's unfamiliar doesn't mean it's not normal either. It's just how you're taught to think. Here we are lifting our voices, pushing for better choices. No longer silent. Time to start healing, healing from the hurt. Time to keep fighting for what we deserve. This system's not changing, so we must be the first to put one foot forward. Start moving forward by healing from the hurt. Start healing from the hurt. Hey, I have a question. What if you walked in my shoes and saw we have so much more to lose? Would you finally see? Just because it's unfamiliar doesn't mean it's not normal either. It's just how you see your world. Here we are lifting our voices, pushing for better choices. No longer silent. Time to start healing, healing from the hurt. Time to keep fighting for what we deserve. The system's not changing, so we must be the first to put one foot forward. Start moving forward by healing from the hurt. Start healing from the hurt. I'm healing from the hurt. Just because it's unfamiliar doesn't mean it's not normal either. It's just how you're taught to think. Here we are lifting our voices, pushing for better choices. No longer silent. Time to start healing, healing from the hurt.
the system's not changing, so I will be the first to put one foot forward. Start moving forward by healing from the hurt. I'm healing from the hurt. Start healing from the hurt. I'm healing from the hurt. Hey, I have a question. What if the roles were reversed and the so-called losers we came first? How would you feel? Thank you.